warahmatullahi wabarakatuh. My name is Nur Izzat Tiramidi Kamen. I am from SR 245A, and today we're going to present about the gait and postural analysis, and our patient is having a knee injury, which is anterior cruciate ligament, SCL grade 3.
So the first slide is I'm going to explain about biodata of client or patient. So the name is Akilah Syahirah binti Nordin. Date of birth is 20 April 2001. Age is 22 years old. For the gender is female. And then for weight 63 kilogram, and for height is 133 centimeter. And then date of diagnosis is 21 October 2022. Type of injury is right ACL and meniscus tear, bucket handle. For the sport is futsal and basketball. So for first injury is October 2022 and last injury is October 2022.
I'm going to present about the introduction of gait and postural analysis. Gait analysis is an examination of how the body moves from one location to another, and it is often by walking or running. Gait analysis also is used to detect any irregularities in our movement. A person's gait is a complicated collection of processes that involve the utilization of the body's vision, somatosensory, and vestibular system. Postural and gait disorder can result from difficulties in any of these systems, as well as problems in the joint that involve. Postural analysis is a process of analyzing your postural balance, alignment, and asymmetries, and your motion. Okay, reason why we are doing this analysis is because of gait abnormalities involving unusual walking patterns that may be caused by disease or injury. Such irregularities that can lead to pain in the hip, back, neck, feet, knees, or ankle. Because of my patient is having a SCL, so she might be having some discomfort in at her knee.
Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Alif Daniel, and now I will explain about walking gait cycle. So the walking gait cycle is the repeated pattern of movement that occur during walking. It is a complex movement that central nervous system coordinate. It is required for effective and safe walking. So other than that, age, weight, height, and overall health are all the characteristics that might influence the walking gait cycle. So, changes in the gait cycle may indicate the presence of a medical health condition, such as neurological problem or a musculoskeletal injury. It comprises two major phases, which are the stand phases and the swing phases. In the stance phase, it is the period of time when your foot in contact with the ground. It accounts for about 60% of the gait cycle. So the first one is initial contact. Initial contact is the first time your foot meet the ground during the stance phase. Second one is the loading reaction. It is the time it takes for your body weight to be transmitted to your foot. The third one is the length of time. When your body weight is evenly distributed between your 2 feet, it is referred to be as the mid-stance. And the last one is the terminal stance. The terminal stance is the time where your body weight is moved from one foot to the other. So next, I will explain about the swing phase. So, the swing phase is the period of time when your foot is not in contact with the ground. It accounts for about 40% of the gait cycle. So, same as the stand phase, it also have an initial, but this time is the initial swing. It's the time where your foot lift off the ground during the swing phase. So the second one is the mid swing which is the time where your foot move through the air. And the last one is the late swing. Is when your foot is ready to contact the ground again. Okay, now I will explain about anterior cruciate ligament injury, which is ACL. So, an anterior cruciate ligament, which is ACL, injury is a tear or sprain of the ACL, one of the 4 major ligaments of our knee. So, the ACL run diagonally from the front to the back, and which is placed in the center of the knee joint. So it helps prevent the knee from hyperextending or bending too far back and spinning too far. So it helps in the stability of the knee during action involving abrupt changes in direction, such as pivoting or cutting. So an ACL injury can range in severity from a moderate sprain to the full tear. So, mild sprains are usually treated with RICE, which is rest, ice compression, and elevation. So, surgery may be required for more severe sprain or rips or tear. So, depending on the severity of the injury, the symptom of an ACL injury can be vary. So, when an injury occurs, frequent symptoms included discomfort, instability, swelling, and also a popping or clicking sound. So, what is the component of ACL, which is anterior cruciate ligament injury? So, ACL is a ligament in the knee that helps joint stability. It keeps the shin bone from moving ahead of the thigh bone. ACL injuries most common in sports that require a lot of jumping, landing, and rotating, including basketball, football, and also soccer. So, ACL injury can be classified into 3 types. So, the first one is the grade 1 sprain. This is the most common type of ACL injury. It involves ligament straining, yet the ligament do not tear or rips. So, the second one is the grade 2 sprain. So, this is considered as a moderate injury to the ACL. It is caused by a partial ligament tear. And the last one is grade 3 sprain. So this is the most serious from the ACL injury. So it is caused a complete tear of the ligament. Okay, now I will explain about the factors that can increase the risk of the ACL injury. So what are the factors? The first one is gender. So when we talk about gender, female athletes are more likely to sustain ACL injury than male athletes. Second one is age. So ACL injury are common in the younger athletes that been active in sports that have a high risk to have ACL injuries. So the third one is sport. So what kind of sport that always that have this type of injury? So for certain sports such as football, basketball, and soccer are more likely to involve in ACL injury because of the movement that they made during the match. So the fourth one is the mechanism of injury. So ACL injury are most common caused by a sudden change in direction, landing from a jump or a direct blow to the knee. So the fifth one is anatomical factors. So some people have anatomical feature that make them more likely to sustain an ACL injury. So this includes having a shallow knee joint, having loose ligament, or having a high Q angle, which is the angle between the thigh bone and the shin bone. And the last one is neuromuscular control. So poor neuromuscular control can also increase the risk of an ACL injury. This can cause by a lack of strength or coordinator in the thigh muscle, or by a poor proprioception, which is the ability to send the position of the body in space. So that's all from me, and next I will pass to my teammates.
I am going to present about the special task that we conduct to our patients. We are using the anterior drawer test for SCM. So first, we're going to position the patient in the supine position with the knee being access flexed to the 90 degrees, so that the foot need to be flat on the surface and the hips will be flexed to 45 degrees. Sitting on the person who will be conducted the special test will be sitting on the patient's foot, and the examiners will grip the proximal tibia from behind while palpating the tibial plateau. The examiners palpate the tendons of the hamstring muscle group with the index fingers to ensure the relaxation. And then the examiner will apply a force on the proximal tibia from the front, and then the examiner will recognize a favorable response if the afflicted side has higher anterior tibial displacement than the unaffected side. So the examiner will be differentiate between the injured knee and the uninjured knee if there is this displacement. As you can see, when the examiners are doing the anterior test on the left knee, the displacement of the anterior tibial is lower because of that is the unaffected side. When she doing the anterior test on the right side, you can see there is a lot of this displacement of the anterior tibial, even though she already had her operation on the last February, but she is not actively doing her recovery, her rehabilitation. That is why she is doing her. She's very slow in recovery her knee injuries. Because of that, you can still see there's a displacement of the anterior tibia on the right knee.
So the first exercise is standing hip extension with resistance band. So for the step 1 is standing on the tubing with your other foot while holding the opposite handle, a chair or flat wall. Step 2 is keep your leg straight and you push it back. Step 3 is push back from your heel and keeping your knee locked straight. And the step 4 is return to starting position and repeat on the other side. So the last one is repeat 10 or each leg and do or 3 set. So the next is, the second one is standing anterior reach. So the step 1 is standing straight with your hand on your just form on your lower abdominal. And then step 2, bend one knee as you reach the other foot forward as far as you can under control. And the step 3 is lightly touch your heel down for added stability. And then for step 4, return to standing straight and then complete the movement 12 times. So the third exercise is prone hamstring curl with resistant band. For the step 1 is lie down on your stomach with your feet hip width apart. Step 2, place the band around one heel and flex your ankle. And then for step 3, bend your knee to pull your heel toward your boot. Step 4, stop when you can't pull any further. So for step 5, return to starting position and then repeat 10 and do 2 or 3 sets. The last one is stationary bike. So for step 1, start with the seat and adjust cycle bike. And then step 2, keep your leg through and sit under the bike. For step 3, do partial revolution, moving the knee in and out as much flexion as tolerable. And the last step is do for 5 or 10 minutes to 3 times days. So last slide is conclusion. So in conclusion, walking gait commonly referred to as walking or motion analysis is comprehensive examination of how someone stand and walking. Its focus of using gait analysis for sport activity is to help the athlete achieve the most out of their performance during a game or activity. However, an individual natural gait may change as a result of an injury or pain, resulting in abnormal walking that can cause more serious health problems. Treatment of abnormal gait caused by osteoarthropathy and nerve and then muscular system disease such as physiological lower extremity joint degeneration gait and painful gait. The rehabilitation for this patient also important to make sure the athlete going back to their current stage before getting the injury, and then the athlete can continue play all sport. So for the target rehabilitation, treatment is method can be implemented for patient, which greatly improve the effectiveness of treatment. So this is why gait analysis is important. Analysis a person's gait allow us to detect their unique movement, establish typical gait pattern, identify pain causing condition, and implement and access treatment to correct the abnormality. Being able to move efficiently is important in avoid injury. That's why gait analysis can be used to improve athletes' performance and injury prevention. So I think that's all from us. Thank you.